What if I told you that obesity is not just about food, but it is about the fear, the frustration, and the fight that many people are silently losing. Many people have been discouraged by the endeavors to lose their weight. So, welcome to Wellness Health Services, this live discussion. Our discussion today, we are looking at what is the obesity, what are the causes, what are the risk factors, what are the diseases associated with the obesity, what are the complications of obesity, and how do we manage obesity. So, obesity is classified as a chronic disease by WHO, and this is a condition where there is an excess of body fat that impairs health. As I have said, it is recognized by WHO as an epidemic, and it is considered as a medical condition. So how do we define obesity? Usually, obesity is defined by what we call the body mass index. The body mass index is your weight divided by your height in meters squared. And if this figure is less than 18.5, then you are underweight. If the figure is between 18.5 and 24.9, then you are within the normal body mass index. And if the figure is between 25 and 29.9, then you are overweight. And if the figure is more than 30, then you are obese. And the classification after you have become obese is classified into mild, moderate, and severe obesity. So let's look at what are the causes of obesity. Usually there is a multifactorial cause of obesity. Of course, the first thing is poor diet. When we are talking about poor diet, we are talking about high consumption of refined food, high consumption of high sugars, and also refined foods and processed foods. Then the next risk factor is physical inactivity. Then there is an aspect of genetics, whereby your genetics have a big role to play in deciding your body size. Then there are individuals who can become obese because of medication they are using. Some of the medications that can make you increase your weight include the drugs that we use for treatment of diabetes, like the oral hypoglycemic drugs, some antipsychotic drugs, some drugs used for treatment of depression, like fluoxetine. All these can affect your weight and can make your weight go higher. We also have steroids used for a long time, and also your mental health. If you have conditions like depression, conditions like some of the mental health problems can lead to obesity. So these are some of the causes of obesity. Then we look at the risk factors for obesity, which include things like family history. If you have a family history of obesity, then your chances of becoming obese are higher. When you live a sedentary lifestyle, most of our lifestyle these days is has minimal movement. You find that the amount of physical work that we do is not so much, and depending on how much calories that we are consuming, then we might be consuming very little of the calories that we take. Then I've talked about unhealthy eating habits, which is usually characterized by high consumption of processed food, high consumption of foods with a high content of sugar, and a very low vegetable content and high carbohydrates. Then we also have age. As you age, then your chances of becoming obese increase more. And the ladies, especially after the menopause, then chances of becoming obese are higher. Then there is the issue of socioeconomic status, has a big influence on whether you get to become obese. And then there is the issue of sleep. For any reasons, if you have difficulties with your sleep, then you are likely to be obese. Sleep deprivation is a big risk factor for obesity. So what are some of the diseases that are associated with obesity? One, we have diseases like type 2 diabetes, we have heart diseases, we have hypertension, we have strokes and vascular problems. We have very many cancers are associated with obesity, like breast cancer, we have ovarian cancer, we have colon cancer, we have ovarian cancer, and then also we have sleep apnea, highly associated with obesity, and also depression. So if you have obesity, you are likely to be affected with some of these diseases. So what are the complications of obesity? One, people who have obesity, they have a higher likelihood of getting joint problems, and so they are at higher risk of getting osteoarthritis. They are at higher risk of infertility problems. They have a higher risk of reduced quality of life. They have increased risk of mortality, and there's the issues of discrimination and the social stigma. Of course, many people in society do not realize that obesity is a disease, and they take people who are obese as individuals who are overfeeding, who are living a sedentary lifestyle, and this can lead to frustration and also discrimination of persons who have obesity. So what are the ways that we can treat obesity? One is lifestyle changes. This means that looking at our diet, we try to look at more of whole grains and more of whole foods, reduce our sugar intake, and also increasing our vegetable content in our diet, and also increasing our physical activity. When we talk about physical activity, what is recommended is more than 30 minutes of moderate to intense exercise for 3 to 5 days per week. Then there is need for behavioral therapy to change our attitudes towards food, to change also our attitude towards our body size, and also to look at things that we can do to live a better life. And remember that when we are talking about obesity and changing our lifestyle, we are not talking about a short-term process, but it is the consistent undertaking of healthy feeding and consistent undertaking of exercises. Then there are medications that you can use to reduce your body size, and this can be need to be taken over a long period of time. Then we have some surgeries that can be used to reduce your food intake. The common ones, of course, there is the body removal, the removal of fat in the body, and also there is the surgeries to reduce the stomach size, so that your capacity to hold more food is reduced. And the surgeries have been shown to work more than 75% and also they have been shown to improve the quality of life. Then of course there is the issue of support groups and counseling, because one of the important thing is to know that this is a journey. It is not a destination on its own, and that even if you are obese, you have an opportunity to change your lifestyle and live a better life and be able to live healthy. So what are some of the myths about obesity? That obesity is just lack of willpower. There are people who feel that way, but the truth is obesity is a complex medical condition which is contributed by multiple factors. Uh, you can tell someone who is unhealthy by their size, but this is not true. Health is more than just a number. It's more than just your BMI. It is more than just the body, your body look. All diets work the same. It is important to know that in this era, personalized care is gaining an upper hand in the management of individuals with various conditions, whereby your genetic makeup is looked at, your lifestyle is looked up, and your advice, dietary advice, is formulated based on these factors. So you get more of personalized care. Then there are people who feel that exercise alone is enough, but the truth is it is a diet, it is your mindset, it is the support that you have that will give you the results that you need. So it is important that we realize that obesity is not just an issue of food, it's not an issue of just not being active, and it is not a joke because it has medical consequences. And we realize that this is a disease, and the healing starts with the empathy and the understanding. So what do we need to know about obesity? One, it is important that we learn the facts of what can be done. We appreciate this as a disease and we look for medical care. Then it is also important that we spread the truth about obesity among our circles. It is important that we support people with obesity with kindness and do not judge them, because already they have tried a lot. They are going through a lot of issues. They have tried diets, they have tried exercises, and sometimes they are feeling very frustrated. So understanding is very important. Then it is important that we advocate for healthier communities. When we talk about healthier community, we are talking about undertaking exercises and embracing exercise as a society, embracing healthy food as a society, especially the whole grain and fiber dense foods, and also creating an environment where people can exercise, having walkways, having places where people can cycle, and also having green parks where people can go and exercise, and they have them designated areas where people can go and relax and they also exercise or cycle. Then it is important that you realize that fighting with obesity and curing obesity is not a one-time undertaking, but it is a journey. It is a lifestyle issue. So what your body size is today is not the destination, but it's the decision that you make to reverse this that counts. So it is important to start small, eat well, have a positive image about yourself, have a community around yourself, support groups, and remember that sleep has a big impact on your body size, and also mindfulness can help in overcoming your weight. So it is important that you help someone rise above their weight, and you are not only helping them lifting pounds off their body, but you are lifting the pain, the prejudice, and also the potential that is in them is being looked at. So it is important that we realize that obesity affects a significant number of the population. This has been declared as an epidemic by WHO, and all of us need to get involved in fighting obesity. So thank you for watching. I welcome questions, comments. What have been your experiences in fighting obesity? And you can also share some of the tips that you have had about obesity. So I welcome comments about what you feel about obesity, what you feel we need to do better to fight obesity, and also share with us what are some of the risk factors that you feel are contributing a lot to this epidemic. So comments about what is obesity, what have been your experiences about obesity, and what are some of the challenges if you have remember that almost all of us to some extent are either overweight or we are obese. Almost more than 50% of the population are within the obese category or overweight category. So in the absence of any comments or questions, I would want to summarize that obesity is a world epidemic. It is characterized by your weight being more than is expected for your height, and this is contributed to multiple factors, including genetics, including the food, including the environment, including your socioeconomic status. And being obese is a big contributor to some of the medical conditions like diabetes, hypertension, obstructive sleep apnea. Obesity is a risk factor for many of the cancers, and it is also a contributor to osteoarthritis. And it is not an individual mistake, but it is a multifactorial factor. So we need to learn to appreciate persons with obesity and appreciate that they have a lot of difficulties, both physical and emotional, and support them. And we need to create an environment where all of us can create the appropriate body weight. Thank you for watching. Remember to share your comments, your concerns, and also your tips on how you have been fighting obesity in the comments section below this video. And remember to subscribe to the Overall Health YouTube channel for more content on living a healthy life. Remember also to follow us on our social media channel in Facebook, LinkedIn, and also on TikTok, and also on Instagram. Thank you very much.
No question. Question.
Where is it? Okay. Someone has asked, how can I safely lose weight, and what kind of diet and exercise plan would you recommend? One, to safely lose weight, as I have said, this is a journey. It is not a one-time thing. So some of the foods, there is a lot of nutritional issues. The most important thing is reducing the refined foods almost to nil. So if we can embrace whole foods like whole carbohydrates, whole proteins, and avoid the processed meats like sausages, bacon, all these refined foods, they can really help. And also ensuring that our diet has a lot of vegetables. This is what we call the DASH diet, which is composed of more than 50% of your plate is vegetables. Then you have about 25% is proteins, and it is more of the lean meat and also the plant proteins, and then the carbohydrates is the whole carbohydrates are high in fiber content, and they are slowly absorbed in the body. They can help in fighting enhancing your nutritional status. Of course, you have to remember that you also need to take fruits, take adequate also of water, and we recommend at least 8 glasses of water in a day. Then the other thing that is important when we are talking about exercise, exercise, we are talking about more than 30 minutes of moderate to intense exercise, at least 5 days in a week, which comes to about 150 minutes per week. And the most important thing when we are talking about exercise is the consistency. It's not something that you take today and then you do it 3 months and then you say I've been exercising. And I've seen people fairly frustrated. You have exercised for 3 months, you have not even lost 1 kilo, or you have only lost 1 kilo, and you feel frustrated. Of course, there are other things that you can do to enhance your weight loss, like intermittent fasting. If you look at some of the videos in the Overall Health channel, I've talked about intermittent fasting. There is need for adequate sleep, which we talk about at least 7 hours of uninterrupted sleep, and then also practicing relaxation, because it has been shown that any mental stress can contribute to weight gain, and so having a relaxed mind is very critical in fighting weight. So those are some of the tips that you can do to help you lose weight. And remember that this is a journey. Making a decision is the first step, and staying committed to the process is what will make you have results. So let's remember that don't start, don't give up, and even if you don't see obvious weight loss, by the fact that you are eating healthy, it is already an improvement in your health. By the fact that you are exercising, you will feel generally fit, and you will be able to feel good about yourself, about your physical health. And remember that long term, you will see the fruits as you keep doing these things. Thank you. So thank you very much. Keep watching, keep commenting, and let's join together to overcome obesity. Thank you for watching.